Good. How are you?
Doing well. Well, I'd like to introduce you very briefly.
Thank you.
Okay, as an executive for many years in the pharma industry, in both commercial, government affairs, as well as medical operations. Your work spans across different disciplines. You're a TEDx speaker, a founder, and an entrepreneur. And we can't wait to hear about modern neuroscience-based strategies to eliminate bias and make better decisions, Sandra. So take it away.
Wonderful. Thanks so much, Tim. And hello to everyone. And thank you for welcoming me to the Medical Innovation Olympics. I greatly appreciate it. It's an honor to be here as part of the community, really committed to the science of bringing innovation from the bench to real world impact for patients. And so whether you're a founder or a medical affairs leader or an investor, you're here because you care about turning innovation into outcomes. And so, the theme of this year's event, Layer the Science, Leap with Defiance, can be more than a tagline. And I think it's really important. It can actually be a method. And so what we're going to discuss today is really practical. It's how you can layer the science with discipline of clear, bias-aware decision-making so that when we do leap, we do it boldly and credibly. So that's really our focus for today. And really, this can be about decisions for yourself, but it can also be a lot about the team. And I'm going to talk quite a bit about how to do that best with teams. So great. Let's get started. So over the next 30 minutes or so, I'm going to share 3 practical ideas that you can literally start using today. We're going to talk about 3 common recurring decision-making patterns that happen and where we might be getting ourselves into trouble. And then we're going to talk about the neuroscience behind why these happen and how that impacts our decision-making. And then I have a couple very practical things for you. One is a decision-making framework called The Bolder Way that can really help you think through stepwise how to make better decisions, both individually and as a team. And then I also realize sometimes you just need something quick. So we're going to have a very practical quick decision audit that you can do, again, either on your own or together with the team. And the reality is the goal is not more theory. It's really usable clarity. And I love what Chris talked about too with his stories and around the importance of bringing clarity. So we're going to talk about that. And really a language and a rhythm to make decision-making faster and fairer and easier to trust. And I know he also raised the importance of trust, and that comes through a lot in decision-making, particularly when we get into teams. So let's talk about where progress most often slows. And these are these invisible decision-making patterns. One of the most powerful truths is that even our best decisions are vulnerable to invisible cognitive biases. We each make about 35,000 decisions a day. And to navigate that efficiently, our brains use unconscious shortcuts or patterns of thinking. And these patterns shape what we notice, how we interpret the world, and what we do next, often without us realizing it. And the reality is that decision-making is often a team sport where all the individual experiences and decision-making preferences come together with others and can lead to really predictable errors in our thinking. So let's look at the most common 3 patterns. The first that I'd love to highlight is status quo bias, and you've likely heard of this. It's the powerful pull of what's familiar. And it's the preference for maintaining one's current state and opposing actions that might bring changes to that state. And when uncertainty rises or timelines are tight, our minds seek comfort. The amygdala, that's our brain's early warning system. It nudges us towards the safest path. It wants us to go towards the one we already know. And it can sound like things like, well, that's not how we've been successful in the past. Or someone saying, well, how does that compare to what we already know? These phrases can sound prudent and they feel responsible, but underneath it's actually our alarm system rewarding our caution. Our brains are wired to keep us safe and signal danger, including when that danger comes from a potential change to how things are usually done. So I'm going to give you a little example. So consider an example where there's a group of people that have come together to do a review. They're talking about a novel disease monitoring method. And at first, curiosity fills the room. And then someone asks, well, what's the precedent for this? And the mood shifts. Like you can almost feel the brakes come on, and curiosity gives way to caution. And no one says no, but they steer towards what feels safe. And by the end, the group has designed a comfortable replica of what's always been done in the past. And if we look at why does this happen, it's because repetition can feel like reliability. And in highly regulated systems, that instinct can protect us, but it also creates inertia and a pull towards the status quo. And it can squash innovative new ideas in favor of the familiar because familiar feels safe. So I have a couple watch outs for you that you can use. If you hear these things, if you hear best practices or that's not how we do things, cited as reasons not to adapt, that's a bit of a flag. And also if you see people really trying to make comparisons that flatten a new exciting idea into something more recognizable, that's really status quo bias in action. So what can we do about it? There's a couple counter moves that I wanted to share. One is encouraging the group to list a risk of action and risk of inaction. Most teams only see the risk of action, but often there's really significant risks included in not acting as well. And highlighting those can really bring a better decision. We can also look at what's the smallest, safest test that could genuinely change your mind. And it can be worth doing that test just to see if we're really stuck in status quo bias. And so I would love for you to be part of the conversation as we go through this today. Please feel free, write in the chat. I would love to hear from you. I'd love to hear your questions. So let's look at the second decision-making pattern. This one's confirmation bias. And again, you've likely heard of this, but it comes up a lot. So I thought it was worth raising today. It's the tendency to interpret new evidence as confirmation of one's existing beliefs or theories. And it can actually show up in different guises. It can look like confidence and focusing on positive data that supports our views. But it can also look like finding confirmation for our fears. So dissecting every flaw until the team can no longer move forward. It has a different expression, but the same circuitry. So I'll give you an example. I worked with a research group that was celebrating strong pilot data for a new project. But there were implementation experts on that team that flagged that the daily workflow could be difficult and that billing was uncertain. The project lead smiled and said, you know what, it's fine. Once people see the value, they're going to figure out how to make it work. Listen for those kind of sentences. It should give you pause. It means that belief in the hypothesis has outweighed curiosity about reality. Months later, the science was intact, but adoption had really lagged, not for lack of data, but because they had overlooked important implementation details. And why does this happen? Our brains are reinforced for confirmation. When we encounter information that supports our ideas, dopamine in our brains give us a little reward. They say like, good job, keep going. And disconfirming evidence triggers cognitive dissonance. When we encounter information that supports our thesis, we get that reward. When it goes against it, we don't, and we're craving that. And so we unconsciously rationalize things, or we even postpone discussions altogether if we think that they're not going to be aligned with what we'd like to see. And it can be unconscious, so that's why it's important to think about it and make yourselves aware. And social dynamics can amplify this. This is why if a senior leader who sponsors the project speaks first, others may hesitate to share a different viewpoint. So I included a couple watch outs for you. If you hear things like the N on the study small, but only for inconvenient results. So you're kind of making excuses for getting rid of those inconvenient results versus highlighting those and really seeking to understand and keeping that curiosity. Or we'll fix it later when later has no definitive timing or plan. That can be really dangerous as well. And a counter move for you to consider, you can run a quick 10-minute challenge round. And then each person in the group names the ways most likely for the plan to fail, and the team writes evidence for what could force a rethink. You can rotate the designated challenger. You don't want one person to do it all the time because then it can become personal. And it also makes dissent routine. And you can record every piece of disconfirming observations and then a threshold for action. This makes the disconfirming evidence just as visible as what we want to see that's really doing that confirmation. And remember that bias can also appear as supporting beliefs that confirm our negative beliefs. So that means we can sometimes get caught in a loop where we're endlessly looking for information that supports our concerns and reasons to not move forward. And so again, please feel free, would love to hear from you. You can write in the chat if you've sat in a meeting or been part of a discussion where analysis keeps deepening, but decisions really never advance. And that can really happen when it's not because our teams lacked rigor, but it's because that rigor is turned inward. And that same system that ensures quality can, under stress, really work to confirm our preconceived ideas. So the third one that I wanted to share for you is a little bit different. I'm sure you probably heard the two. They're pretty common. This one's a little bit sneakier. It's completion bias. So that's the drive to complete actions or tasks. And it's really often regardless of strategic value or impact. And it rewards that completion instead of necessarily the value of the progress. Each done that we do triggers dopamine. That's our internal applause track. And unfortunately, closure can really trade tomorrow's options for today's relief. So you have to be really careful about this one. I'll give you an example. So a cross-functional group finalized materials a week early to hit an internal target. They met the date, they celebrated, but they had unknowingly locked in language that limited flexibility with regulators later. That quick completion felt productive, yet in the long term, it was expensive. A bias for completion shows up as intellectual closure as well, declaring an analysis complete because more work on it feels slow. And why it happens, again, dopamine's involved. It says, that was great, let's do that again. And it's wonderful for building habits and motivation, but it's also indiscriminate to time horizons. And as a leader or a team, you can unintentionally turbocharge this pattern by applauding visible motion, and that can drown out more crucial, thoughtful steps that create compounding advantages tomorrow. So there's a couple watchouts that you can kind of pay attention to be mindful of this. One is if milestones are defined by visibility, not relevance. So be really thoughtful when you're defining what your milestones are. It can be about commitments made early that can shrink room for adaptation later. So watch out for those. And phrases like, we can always adjust later, when later hasn't really been scheduled or rarely arrives. So a couple counter moves for you. One is to pick long-term signals or milestones that truly define success, and then tie quick wins to that, or don't count them at all. And another is a simple option check before finalizing. You can think of something like, if new evidence appears next quarter, will this limit our ability to pivot? If the answer is yes, then pause or structure the decision differently so that you're not locking yourselves in to potential optionality later. So again, would love to kind of hear your thoughts if you'd like to share. If you've seen a team focusing on finishing rather than learning, would love for you to share that. And, know that you're not alone. Of course, celebrating finishing is great, but celebration for meaningful milestones that build towards a positive, impactful future can be so much better. So these three patterns, status quo, confirmation, and completion bias, they're not signs of weakness. They're predictable responses to uncertainty, to time pressure, social dynamics, and incentives. They're the way our brains balance fear, focus, and reward. By naming them, we lower our defenses and we raise the quality of our next conversation. So now we can look at how we can transform this awareness into action. So why did these patterns recur so reliably? And neuroscience actually offers us a simple, useful model to think this through. The first is the amygdala. So you can think of your mind as having a team with three loud voices. The amygdala is your smoke alarm. It's fast, it's automatic, and exquisitely tuned to potential threat. In innovation work, threat often takes the form of ambiguity, uncertain timelines, unclear signals, mixed incentives, and the alarm doesn't distinguish well between burnt toast and real fire. And under pressure, it can really dominate the conversation. You'll hear it as stop, or wait, or freeze, or sometimes the opposite. It can be do the safe thing right now. The second voice is your prefrontal cortex, and it's your architect. It can hold multiple scenarios in your working memory, it weighs long-term trade-offs, and it designs plans. But it's slower and it's metabolically more expensive. Under stress, when our bandwidth shrinks, the architect can get drowned out by the voice of the alarm. The result is either analysis paralysis, endlessly scenario spinning, or if the alarm's louder, a hasty move that feels safe but might be poorly matched to the real problem. Alternatively, the investment of time and energy can also create a need to hold on to what's already been created and the desire to look for evidence that supports the current plan or our current way of thinking. And third is dopamine. We've talked about that a little bit. That's our cheerleader. It's our brain's do that again signal. Quick wins, visible progress, social approval, all produce little chemical pats on the back. And that's invaluable for keeping teams motivated through long-term projects. But it can also mean that a flashy milestone can feel better moment to moment. It fuels perseverance, but it confuses completion with progress. When the alarm, the architect, and the cheerleader talk over each other, we can actually get some predictable results. When the alarm wins, we get status quo bias. When the architect defends its own model, we can get confirmation bias. And when the cheerleader pushes for the satisfaction of being done, we can get that completion bias. So what do? How do we quiet that noise? Well, there's a couple really practical things that you can do that give you small but quick resets. The first is label the state. If you say what's happening, you can understand it better. So you can say, our alarm is really high right now. That single sentence signals safety, lowers cortisol, because language regulates emotion. The second you can do is externalize thinking. When your architect is on overload, you can move ideas out of people's heads and onto a shared screen, a whiteboard, a piece of paper that everyone can see. Visualizing your assumptions and trade-offs together turns private anxiety into public reasoning. And the third is you can train for learning, not finishing. So teach the cheerleader to celebrate learning, not just finishing. Applaud a pilot that disproved a hypothesis. Reward the update that prevented waste, or celebrate actions that are directly tied to our future success. And that's how teams can retrain their reward systems. And it's important to know different people in different disciplines can be more tuned to different voices. Like often clinical teams are more tuned to an alarm voice, rightly so, but being aware of it can be important. Data teams tend to be more tuned to an architect voice, and communicators can be more tuned to cheerleaders. And the friction between them isn't dysfunction, it's diversity. So when a colleague seems overly cautious, be curious. You can ask, what risk in your training and experience is tuned to detect? And then how can we redesign for it without freezing the whole process? That one question can turn tension between different perspectives into teamwork. And the good news is that the same neural wiring that creates bias actually allows for its awareness. Once we understand the system, we can design decisions that work with the brain, not against it. Okay, so now on to simple ways that we can design for the best possible decisions and impact by converting awareness into aligned action. So we can talk through a simple decision-making framework. Called it the Boulder Way, and it's 6 steps that you can run for bigger decisions, or we'll do an abbreviated version for faster ones. You can think of it as layering science with decision clarity so that your leaps are bold and defensible. So not surprisingly, the B stands for biases and blind spots and can help you see the invisible. So each person brings your own preferences and experience, and you work within unique environments. And that can make you personally more prone to some biases than others. If you're highly tuned to risk or prefer to be highly structured, you're actually more likely to favor status quo over decisions to try something that's less proven. If you work within a culture that incentivizes progress, you're more inclined to choose a decision with short-term gains. And perhaps surprisingly, and I think essential for this audience, if you're highly educated or intelligent, you're actually more prone to confirmation bias because you tend to be more secure in your own existing knowledge and therefore less likely to seek out contradictory information. So self-awareness of our own biases and then putting those together and thinking through the biases of the individuals within a group is a key first step. And the more that you understand and see your biases in action, the more you can work to overcome them, which is the first step to bolder decision-making. So if we go into O, it's observe, and that's about disciplined curiosity. And here are a few actions you can take. List what the team believes to be true about this decision, and then which beliefs are backed by data, which are just assumptions that we're making, and are there any that are just habits that are being carried forward? And then circle assumptions that, if wrong, would matter most. Then we can classify the decision as reversible or irreversible. Our speed of our decision should match the reversibility. If we can go back easily on a decision, we can go forward quickly and experiment more. If the decision's irreversible, it's worth taking a little bit more time to think it through. And writing down our decisions together make our assumptions visible. And if a change in an assumption would change your decision, you can decide together how you can best test that assumption. Observation converts debate into design, and it also invites humility, which is the starting point of great science. So if we go on to L, it's learn. How do we broaden our perspectives? We can bring in voices that are most likely to see our own blind spots. You could bring in a site lead, a data analyst, a patient representative, a systems partner. And if a different perspective challenges you, that's a clue to pause and lean in. Some of the best insights come from those who see the world differently. And learning also means unlearning and being willing to change your mind. In a rapidly changing world, teams that unlearn the fastest adapt the fastest. Okay, on to D, actually the decision. So decision discipline is clarity, not necessarily speed. And you need to state exactly what is being decided, why it's being decided now, and what principle or evidence guided this choice. Write it so that someone absent can understand it. And I give a little example of a framework that can be really helpful. So when you write why you're deciding what you're deciding, you can say something like, given A, B, and C, we're going to do X by Y this time frame, and here's who's going to own the decision. And we'll reassess if Q occurs. This makes it so clear for everyone. We've all been in those meetings where a decision's made and then everyone walks out and they have really different ideas of what happened in that meeting. And then that can lead to a wide variety of execution and often is the root of the problem. So if you can also capture dissent respectfully while you're in the meeting, that can also go a long way to clarity. And note what evidence would change each opposing view. This keeps disagreement scientific and evidence-based. Once you do this and you have this kind of clarity, people can execute a transparent decision. They can't execute an invisible one. So you can really focus on writing it down in a way that's shared and easily understood. And that leads us to empowerment. Once a decision's made, people need to move forward with what to do about it. What's the change we're going to do? What's going to happen now because this decision was made? And once intent and boundaries are clear, you can really give people the authority to decide how to implement the decision. That's empowerment, and it's trust with context. Empowerment keeps accountability close to the expertise, so who knows best how to do that work, and it can turn execution into distributed intelligence across your team. Clarity enables autonomy, and autonomy plus clarity creates speed with clear direction. And that's how you really take the best decisions and turn them into impact. And the last one is one that's often skipped, but can be really powerful. It's about recalibration. No decision is final. It's a living hypothesis. So you can schedule check-ins before you leave the room. You can ask, what will we examine when about this decision, and what threshold signals a decision change? You can create a 15-minute work change simple review that keeps the learning visible. Because courage keeps us moving forward, but reflection keeps us on course. Reflection really turns boldness into learning into mastery over time, and converts experience into evidence. So thinking about this group, it's a scientific audience. I thought you might find this really interesting. If you look at all the different steps in the Boulder Way to how to make better decisions and to really turn decision into impact, there's actually really great alignment with the scientific method. So if you look at biases and blind spots, that's actually how we frame our hypothesis and really understand the situation. Observe is where we collect data. Learning is where we look at peer-reviewed. So what else can we understand about different perspectives? Decide is really coming to a conclusion based on the first steps. Empowerment is how do we translate that into practice? And for recalibration, that aligns nicely with replication and iteration. It mirrors how good science advances, structured curiosity leading to tested insight. And I also thought that this could also be helpful for you to have. It's around language. So language can be very important when we're looking at decisions, both in terms of talking it through to make sure we're all on the same page, but also to give us clues about reminders of the process. So often in teams, I hear things like, let's observe before we decide, or it could be, who's the missing voice that we should learn from, or let's recalibrate. And over time, this language, these verbs can become cultural shorthand for clarity. I also realize that sometimes there isn't time for all 6 steps in the process. Agendas get crowded, the pressure's high, and a decision needs to be made today. So that's where I bring in the decision audit. It's a micro version of Boulder that helps deliver clarity in 5 minutes. Super simple, 3 big questions, 1 slide. So question number 1, what assumptions are we making? List them all, even the obvious ones. And then ask, what could make this assumption false? If nothing could, it's a belief that's not evidence. And it's important to write the assumptions down. I've been in so many sessions where everyone literally assumes that everyone else is thinking about the same assumptions that they are. So just going around the circle, even if it's a couple people together, and just talk it through and write them down. Writing them makes them testable and transparent. The second is voices. What's missing from the room? Invite or represent a perspective that would challenge the choice the hardest. If you're making this decision, who would challenge you the most? Is it a clinician, a regulatory, a payer, a patient voice? And if they can't actually join your meeting, which is ideal, even if they come for a few minutes, bring their data, their latest email, their metric that they would use. This step transforms criticism later into contribution now. And the third is signal. So how will we know that this decision is working? Choose one leading indicator that everyone will see soon. It could be percentage of high priority sites submitting clean data within 30 days for a trial. It could be average time from field question to resolution. It could be the repeat number of adopters in the first wave of clinicians. Pick something that's relevant and make that signal visible at your next review. The progress should be public, not private. And you can run this decision audit before any major choice. And again, if there's any surprises, it can become a shared reflex, your cognitive safety net. So would again love, feel free, write in the chat. I'm really curious of these 3, whether it's assumptions or voices or signals, is there one that would most improve your team's next decision? Would be curious about that. Oh, hey, Tim.
Hey there, Sandra. Enjoyed this presentation very much. I'm going to make sure, remind myself to post it in our resources in the Hova event platform as well.
Sure.
Yeah. So could you comment on just the speed of the decision making as well, and how that impacts,
Yeah, absolutely. And it can depend on the decision you're making. I mean, you don't obviously need a deep framework for every single decision. You can just decide what you're going to have for lunch. But decisions that have long-term implications, definitely worth slowing down, taking a little bit more time, making sure that you have diverse voices in the room. Also, if the decision is more likely to be irreversible or have downstream effects that really narrow your choices later on, it's really worth slowing down and taking the time to be thoughtful about how you make those decisions. You will not regret it later. So that's really the best thing to do about speed. Yeah.
Yeah. Well, we're getting some comments here. Janelle Hardesty enjoyed your talk, as well as Chris Cook.
Thank you so much. And please, if anyone has any questions, reach out through the platform, available through LinkedIn. Always happy to chat. So any other questions or anything I can do to help, please just let me know.
All right. Great. Thank you. Thank you very much, Sandra.
Wonderful. And thanks, Tim. Thanks for having me. Looking forward to the Olympics. Excited to see it get started. Thank you.
Absolutely. Thank you.